So if you have an injury from falling off, straining a joint, what can you do to improve recovery?
First thing is, ascertaining whether anything's sort of broken. Again, if you're sort of whacking something hard, something might break. So definitely kind of get that cleared out first. Secondly to that, we're thinking in stages. So that initial stage is 48 to 72 hours post-injury. And that's actually pretty critical in terms of, how that injury healing sort of takes place over the next sort of week, 2 weeks. So, we're trying to basically sort of manage inflammation and managing pain. Now, kind of gone are the days where we just whack ice on straight away for everything, and we take an anti-inflam like an ibuprofen, and we try to stop inflammation. The idea is it's not necessary to be pro-inflammatory, so to encourage inflammation, but it's not to worry if there is inflammation there. Inflammation is really, really important. It's it's newly oxygenated blood. It's proteins required for protein synthesis. It's all the sort of vitamins and minerals and stuff that's needed for sort of metabolism to kind of take place, right? So, it's really important for it to be there. The issue is when it stays there. So what we invariably look at is trying to get it to flush out. So it can come in, but we then need to then get out. So we look at the fluid transfer. Now, obviously, if you're getting pain, ice really helps in terms of sort of analgesia. So it's a fairly sort of simple model for that. It allows you to manage how much inflammation there is there. There is always a sort of toss up with that. If you are going to ice it, generally speaking, 10 minutes every hour is perfectly adequate. Bag of frozen peas is pretty accessible for most people. Having enough ice to do something like an ice bath is pretty tricky. Bag of frozen peas is perfectly fine. It's often easy to have 2 bags of frozen peas, so you can kind of have them on sort of rotation. Obviously, don't eat them afterwards because you'll get yourself a little bit sick. That's the sort of generalized kind of response. It's still based around that sort of RICE model, so rest, ice, compression, elevation, but we've added a few things to that. And invariably, it is about actually active movement. So we rest still, but we rest from aggravating activities. It's not complete bed rest, right? Now, obviously, aggravating activities, it might be aggravating to walk, right? In which case, we don't go and walk, right? Unless we kind of need to. So it's resting from aggravating activities rather than just don't do anything. Obviously, within that is active movement. So let's say it's your knee that you've bashed. You can still move it. So you sort of put yourself on a kind of settee and just go through flexion extension, sort of as much range as you kind of comfortably got. And again, we sort of do that, sort of 10 minutes an hour, that kind of thing. Again, that would be relatively pro-inflammatory. So you can always then manage that inflammatory flow with a bit of sort of ice, right? Compression is a difficult one because obviously as soon as you start to compress joints, you start to reduce the amount of movement you have through there, which then impacts on the active movement. Some things we will compress. So certainly sort of muscles, for example, you might compress, but invariably actually it's a little bit less dependent on sort of compression. And then elevation is kind of pretty key again in terms of sort of managing inflammatory flow, in particular when we look at sort of lower body. So if it's like an ankle in particular, and to an extent a knee, getting them above hip height is pretty key. Again, it just allows us just to manage how much inflammation there is there. Because again, we don't want to over inflame something, because it then makes it a lot harder for us to kind of get that inflammation down. So that's the kind of first sort of 48 72 hours. And again, there's no steadfast rule. It's always slightly different per injury. Sort of moving on from that, we start to move more towards what we call sort of subacute, and then moving more towards sort of chronic. And again, from there, pain generally tends to go down. So acute pain generally tends to go down. The rate of inflammation generally tends to go down. We can start to contrast the sort of hot cold. So we would start to move less away from just plain ice to more of a hot cold. And again, that sort of stimulates that fluid transfer. So with the heat, we do what we call vasodilation. So vasovascular, so the sort of blood system opens up, so it dilates. So we get more sort of blood flow. And then obviously with the ice, we vasoconstrict. So we sort of decrease the amount of sort of blood flow. And of course, within that is also inflammatory flow. So yeah, we move more towards a sort of hot-cold model. So with that, rather than doing just ice for 10 minutes, we would do sort of 2 minutes hot, 1 minute cold. So obviously sort of 3 minutes, repeat 4 times. So that's then 12 minutes per hour. And that, generally speaking, has good effects in terms of sort of inflammatory flow. Obviously, hot can be like a hot water bottle. It needs to be hot, not just like a hot towel. In the same way that ice needs to be the cold needs to be cold. So ice rather than just like cold water. So yeah, it needs to be penetratively hot, penetratively cold. So hot water bottle, bag of frozen peas, 2 minutes on, 1 minute, 2 minutes hot, 1 minute cold, 3 minutes. Repeat 4 times, 12 minutes per hour, perfectly adequate. And then obviously then from there, the movement increases, right? So we put more reliance on moving more. We might incorporate a little bit more sort of strength work at that time. And again, it really depends on sort of what the injury is. Obviously, the more severe the injury, the more those timelines move to the right? So the more we elongate that timeline, the less severe the injury is, the kind of closer we can sort of move stuff. So, if it's just a little bit of sort of bruising, we might push it a little bit more, sort of 72 hours plus, right? If it's, very, very sort of significant, significant ligament injuries, stuff like that, then we'd be in a more protective model for longer before we then obviously sort of start that loading process. As regards sort of, a visit to someone like myself, kind of any time really. Sort of certainly working in sort of sport. So like when I was working in rugby, for example, you'd see the guy immediately after injury, right? And we would pretty much start that treatment process straight away. So, we'd chuck them on a sort of bag of ice on the kind of sideline, and we sort of get them into elevation, and we get them to do a little bit of just basic movement. And that might be just walking around. That might be sort of sitting on an exercise bike on the sideline, that kind of thing. We'd start that sort of treatment process, obviously sort of post-match. So we might do some very light massage, again, just to kind of stimulate that sort of inflammatory flow. We'll sort of send them away with sort of educative sort of information as regards sort of what to do in the next sort of 48, 72 hours, what have you. The club that I used to work for, obviously we play games on a Saturday. We then had training on a Monday, which is a really, really quick turnaround. Normally it's a Tuesday for sort of non-professional level. It's sort of Tuesday and Thursday training. But again, we'd see the guy on the Monday, and we would definitely sort of see them then, and we'd again kickstart that kind of process. And that again would be a sort of secondary assessment process, and we then sort of move them through. So you can see how actually you don't have to wait until it's like completely settled, like a month later, for us to kind of see it. We can still do stuff early doors. It's slightly less aggressive, and there's slightly less for us to do because we're not getting people to kind of run around, jump around. But the idea again is to kind of create an environment whereby healing can take place, and then progressively load that. And that might be as simple as just saying, don't do that, don't be daft. Why are you going and sort of running a marathon today? That's really not a good idea. Or that might be, okay, you can actually go and do stuff. Let's go and walk, let's go and move. You can sit on the bike on the turbo and sort of tick your legs over. You can ride it, this intensity, this kind of power, right? So, we can definitely sort of do that kind of, put in place that kind of work. And then from there, obviously, it's just progressive. So we kind of go, well, what are we able to do right now? How do we then sort of progress you through? So that might be that we can, up what we're doing sort of off bike loading, right? That might be that if it's a lower limb injury, we can train as heavy as we want upper limb, right? If you've like damaged like your right knee, well, you've got another leg, so we can sort of train that leg sort of really heavy. So there are ways around those injuries that we can still train and we can still develop. And then the idea is, as I say, to then pick up the sort of development pathway for that injured limb, injured joint, injured structure, in a way in which, again, it then gets you then back on the bike as quickly as possible and as safely as possible. And I think, obviously, the sort of safety component, I think, is really important. So less just going gun-ho at it, and actually just making sure that you are safe and actually able to ride, able to do what you want to do, need to do, without risk of sort of further injury. And obviously then within that is then managing that return back to play. So for example, if we're looking at a mountain biker, we might not sort of say, okay, your first ride back, go and rip down a sort of World Cup sort of downhill track, right? We might go, okay, just pedal around some fire road, nice and easy, just get some movement back into it. Go and do a little bit of just, light single track, that kind of thing. Obviously with sort of bike parks in particular at the moment, they're really good for returning people back to activity, because we can kind of say, okay, this trail sort of system is sort of, nice and easy. It's kind of nice and beginner. It allows you to ride. It allows you to move on the bike. It allows you to load those structures, load those systems in a way in which we're getting progressive load, right? So we may sort of spend some time on sort of beginner trails and then progress you through to medium trails and progress you through to expert trails. So that would be the way in which you kind of work stuff. So you can see how actually we can take something from, almost sort of point of injury back to return to play in a very logical and sort of thoughtful kind of process. That doesn't necessarily just have to be you on your own going, I don't know, I guess I kind of stick some ice on it. How's it feel? Well, it's not painful. I may as well just go and rip it. So it just gives you that guidance as much as anything.
What you've described there is all very contextual to the injury, and so there is a real advantage to coming, getting some help if you've got an injury, and it's going to get you back on the bike and also avoid more injuries, particularly like with mountain biking, as you mentioned, like choosing things which aren't going to, because once you've injured yourself, you might be able to move and stuff, but you're probably more likely to hurt yourself, aren't you? If you go and if you've got a weakness there.
Yeah, definitely, and I think it's the impact on skill as well. As I say, we need to kind of re-engage that skill, right? If you've been off the bike because of injury for like 6 months, I'm not going to go, it's all fine, structure, it's all fine, again, go rip it, right? We need to kind of get you to learn those basic soft skills, right? So you're right in terms of it's got to be context specific, and that's context specific in terms of structure, in terms of damage, and in terms of athlete. And again, that doesn't have to be, okay, you're allowed back on the bike, now we do the skill development. It can be, okay, well, we're now in a position whereby we can start doing some, just some flatland stuff, just some, very simple like skill development stuff that is very low risk, but obviously then sort of sets those sort of foundations so we relearn how to move again when we kind of get back on. I think genuinely that applies across all different sort of sporting sort of contexts. Again, when I relate back to kind of rugby, we don't just chuck the guys back into a kind of contact session like straight away. Their first bit of contact would be with me. So they're not tackling like a 120 kilo prop, right? They're tackling somebody who's considerably lighter, so considerably more force. We do, how to learn how to tackle. So we'd start on our knees and very kind of just walking speed and just learning kind of just body movements, body positions. So getting in the right place, getting the timing right, that kind of stuff. And that certainly sort of applies whenever we're looking at sort of technical stuff. So certainly when we're looking at mountain bikers, there is such a significant technical element that I think you have to consider that in the rehab process. So not just going to, can you physically push a pedal, but can you stabilize on the bike? So as you say, the kind of proprioception, the balance component, can you, actually, move the bike around in a way in which you're not going to sort of hit like a rock garden first up and then slap off and then be injured again. So that we've got to sort of throw into consideration quite considerably. Yeah, for sure.